Grampy's so sick?
Let me explain. Well, ureter and renal cancer is cancer of the renal pelvis and the ureter. The ureter is the tube that carries urine from the kidney to the bladder. The renal is the area at the center of the kidney. Urine collects here and then exits through the ureter. Ureter and renal pelvis cancer is a transitional cell cancer. This means that the cancer forms in the lining of the bladder, ureter, or renal. Transitional cells are shaped so they can perform their major function, act as storage areas that can stretch without breaking.
Oh my goodness gracious me, that sounds so scary, Mommy.
I know, sweetie.
But how do they know?
Well, they do something called screening for these problems, especially since Grandpa is over 65 and as a man is more likely to develop this condition.
Wow.
Some symptoms include blood and blood clots in the urine, unexplained weight loss, mid-back pain or cramps, fatigue, anemia, which means that he doesn't have enough healthy red blood cells. After he was experiencing these problems, he went to go see Dr. Marshall. Dr. Marshall called for blood tests, which checked to see how his kidneys and liver were doing. Then he referred him to a urologist. That doctor specializes in treating the diseases of the urinary system.
Ew, who would ever want to be that kind of doctor?
Well, honey, they make a lot of the green stuff.
Ooh.
Then the urologist uses a cystoscopy, a small tube that passes up through the urethra to have a better look at the bladder and then into the ureter. Grandpa had this procedure done.
Ow, how does that work, Mommy?
Well, let's talk about that when you're older, sweetie.
Oh.
Anyway, Grandpa could also have had retrograde pyelography, which uses a special X-ray that includes inserting a catheter into the ureter during the ureteroscopy. Dye is then passed through the catheter, which highlights the ureter and renal pelvis, which makes the cancer light up like a light bulb.
Jeez. Mom, how would they ever treat this?
Well, of course, with all cancers, they can use chemotherapy, but the entire removal of the kidney and ureter is possible. Of course, if the tumor is in the ureter, then they can remove the tumor without having to remove the kidney.
Yay! Oh my goodness, how did he get this?
Well, Grandpa shouldn't have smoked as much as he did. Also, when working in that plastic factory for most of his life, he should have been wearing a mask to prevent the inhalation of petrochemicals, plastic, and tar fumes. And also because of Grandpa's chronic pain, he used too many painkillers that contained phenacetin that also contributed to the cause which led him to develop papillar necrosis. This is where the kidneys are damaged or died off.
Oh. But, Mommy, can I get it if Grandpa has it?
No, sweetie. As long as you don't smoke, don't work in a dangerous chemical factory, or take certain painkillers. Also, this cancer isn't genetic, meaning that no one in our family is predisposed to develop it.
Cool.
I know.
So, Mommy, since you seem to know all about ureter and renal cancer, could you tell me any more, like interesting facts?
Of course, sweetheart. Ureter and renal cancer occur in fewer than 6,000 people in the U.S. and only accounts for 5% of all cancers of the kidney and upper urinary tracts. This cancer is curable in more than 90% of the patients who get this cancer, as long as the tumor is confined to the ureter and renal pelvis area. However, those tumors that are extremely large and deep have a 10 to 15% chance of being cured. It affects more men than women.
Oh. So is Grandpa going to live?
Dun, dun, dun!
Honey, I think so. But we just don't know, do we?